Welcome back to the Last Visit First podcast, where we explore the care from the first touch to the last visit. Today, I'm honored to sit down with Scott Tapp. He's the Chief Executive Officer at Trella Health. Trella's come a long ways. They're the most trusted analytics and growth platform in post-acute and value-based care, helping providers, payers, and health systems identify referral opportunities, improve outcomes, and accelerate growth. Scott stepped into the CE role in 2021 after serving as the president and COO. Under the leadership of Trella, has expanded his capabilities dramatically. A major milestone was with the acquisition of Playmaker CRM, and we'll get into that in a lot of detail. It brought the market intelligence together with customer relationship management, and they're kind of the only game in town doing this. So we're really excited to talk about it. Scott's leadership journey began. He's a Navy guy, just like I was. So Scott and I have a lot in common there. He went from Navy to SaaS boardrooms. He's given a unique perspective on discipline, culture, and scaling companies in complex industries. And he's got some really good stories for us today. Today, we're going to dive into Trella's vision, the future of post-acute analytics, and the lessons he's carried through his career. Scott, welcome to the show. It's a pleasure to have you here.
Hey, man. Hey, Tom. Wow, it's great to be here. Appreciate the intro. And hey, thank you for starting this podcast. This is awesome. I look forward to the great listening I'm going to have an opportunity to have on LVF. Look forward to it.
Thank you. It's something I never thought I would do. I didn't want to do it. People for years have been telling me I should do it. And I finally was at a dinner in North Carolina, and the CEO that I was sitting down with from AuthoriCare is like, you have to do that. You're the guy that can do this and really get the message out in the industry. And there's a lot of podcasts in our industry, and some of them are good and some of them are okay. And she's like, you can get the right people on your podcast and really go deep. And so she gave me some guidance and some advice, and I took it. And I hired Cole Sorensen to be our podcast producer, and it's been fun. Like we're actually really enjoying it. And I never thought I'd be the guy, have the voice for radio or the face for radio. But I'm really enjoying doing this. Let's jump in. Scott, what drew you to healthcare analytics, and how did you get tell us about your path getting to Trella?
Well, I mean, you know it well. I think you and Buffington and Ian picked up the phone and called me one day and recruited me. So you're to blame. It's been a wonderful opportunity. It was a really interesting time when you guys reached out and said, look, we've got a real mission-based company and we need someone to help take it to the next level. So I was flattered, and I don't know if you remember this, but so we had just sold our previous company, and Buffington and I and the board came up with an arrangement. And then I remember it was like March of 2000. You guys call me, and I'm taking a vacation right before I start, and you're like, "Hey, we got a problem. COVID. It's crazy right now." And I literally started at Trella on April Fool's Day 2020, on April 1st. And it was in the middle of a mess. And oh my gosh. Our employees were at home. Our customers were figuring out what to do and how to do it and how to protect themselves. It was a fun, chaotic time, but it was a lot of learnings very fast. So I'm glad to be here. That's for sure.
Yeah, tell us about your career before that. So before Trella, what were you doing? How did you get to, and go all the way back to the Navy, because I'm a Navy guy, so I want to hear, what did you do in the Navy? Rust picker. We all get called all these different kind of names, but what did you do in the Navy?
So the Navy, I enlisted. I was 17 years old, and went in and stationed in San Diego. It was a great experience, great time. I mean, I just think about it. Look, I'm very fortunate to have been born in the greatest country in the world. And I'm very fortunate to have been born and raised by the most amazing parents in the world. So I was given a great opportunity. The Navy was a means for college for me. And I went in as an aviation electronics guy and worked on computer systems on planes. I was stationed in San Diego. I was assigned to a squadron, and we were assigned aircraft carriers. So it was a humbling, wonderful experience. I learned so much. I traveled the world. I learned a little bit about leadership, learned this and that. It was awesome, man. But you were in, I think, were you in about the same time? When were you in?
I was in from 90 to 2000.
Okay, so I was 88 to 92. And I was very lucky. I mean, I was a final checker on a flight deck. That, as a 19-year-old, it was the most exciting thing you could possibly want to do. um, at the time. And I was also lucky because when Desert Storm happened and started in 91, I think it was January 16th, 91, I was standing, I was in our base in Naval Air Station Coronado. So by the time, we took off and deployed, we had months. And so we're very fortunate. And so I was in an interesting time, and I learned a lot. It was a lot of fun. You were a
Yeah.
corpsman. You were a
Yeah, I was a
corpsman?
Navy corpsman, but I was with the Marine Corps. I didn't stay on the Navy side. My only ship time, I spent 32 days aboard the USS Wasp when we floated over to Norway.
Oh,
It was
wow.
one of the worst trips ever. We were doing Strong Resolve 92, and so on the way over to Norway, the Wasp is a LCD-1. Two funny stories around that are a blast. So we're floating over. Unfortunate, a Harrier goes off the ship, crashes. Pilot's okay, he survives. So we had to do squares and wait for the rescue ship to come and get the Harrier, because Americans don't leave,
Oh, yeah.
a Harrier fighter jet in the bottom of the ocean without protecting
No.
it. So we did squares, and then we get up to that. We finally get, you get the pilot back on board, get the recovery and all that crap. And then we get over to we're going through the English Channel, and the weather's just horrible. And the USS Whidbey Island actually ends up, the anchor swings over and pokes a hole in the Whidbey Island. It was our sister ship that was with us. And
No way.
so it was fine, but we had to go get it repaired. And so, and then from there, we went to, we got to Norway to, invade Norway as the Allies do before a practice run. And we got there at D-Day +6. The mission ended on D-Day +8, so we were 6 days late. We It was terrible. So cold. Norway is so cold. And then so the cool part of it is they needed a corpsman to stay back with the Whidbey Island, and so we took the Whidbey Island over to Stavanger, Norway, and I actually spent a few months in Stavanger, Norway, and it was amazing. Some of my family is Norwegian, and so I got to chase some of my heritage and hang out while they repaired the USS Whidbey Island. And then we floated back home, and then the Wasp ran into the on-rep ship, and we lost the back. We lost the back elevator, and
Serious?
so yeah, so we were supposed to go to Amsterdam for Liberty, because we had all these problems on this one mission we were on. They floated us back to Norfolk, Virginia, and we took Liberty at Norfolk, Virginia. So it wasn't a great experience aboard the boat. I actually hated it.
Oh,
Those
wow.
guys that serve on the gray side of the Navy are, they're angels, and they're perfect. But man, I hated
Well,
that side of it.
you know, I was very fortunate. I enjoyed being on a carrier. I enjoyed working on the flight deck. Um, I enjoyed, I was on 2 aircraft carriers, and so we would go out for 6 months at a time and just see the world. And as a, 19, 18, 19, 20-year-old, it just opened
Cool.
my eyes a lot. It's a great experience. And you meet
Yeah.
so many diverse people. By the way,
Yeah.
think about the military. I mean, I had friends from South Dakota. I don't know anyone from South Dakota. I had friends from just from random places all over, and you meet so many unique cultures and people, and so you learn. I think it just you learn a lot. It was a good experience. I was lucky to have done it. I think when you're in, some days are good, some days are like, what am I thinking or doing? But again, it was a means to an education. Anyway, I graduated. I mean, I got out of the Navy. I went, I was always in school somehow. I went to the University of Georgia. Um, I had an interest in science and biochemistry, and ended up graduating with a finance degree, and started off in investment banking, and then got recruited into venture capital early on in my career. We were doing venture deals during the bubble days. Spent a lot of money, lost a lot of money, made some money, but it was an interesting time. But then I was around my late 20s, and I said, "Look, I want to be an operator. I want to sit on the other side of the table and understand what it's like to build a company like you have done and others." And so I went and joined a company, public company, and was able to have great success there, building the foundation of my career, in strategy and business development, and became a general manager and ran sales and things like that until we sold it. And then I've been part of building 4 companies. Trella my fourth, and I've been an operator for, like, I don't want to say it, 22 years now, and I haven't looked back. I keep saying that maybe one day I'll go start my venture fund, but if I ever get invited to, I don't know, a group maybe like MAG, I'll have something to do and invest in. No, but I just love building teams, and it's been a fun ride. I've been very lucky.
Yeah, Scott's talking about the MAG. That's the Maxwell Advisory Group. That's our venture fund that Jennifer Maxwell and I built. So he's trying to get his name in the hat, but yeah, we'll get him in there somehow. It's cool. Scott, you're, first of all, thank you for your service. I know
You
it's
too.
an honor, and people tell me that all the time. And everywhere I go and I see service members, I always buy their lunch or buy their dinner or buy them a beer or something and always say thank you. And I wished everybody in America would do that for anytime you see someone that's sacrificing their life and serving this country.
We're so lucky.
Yeah, there's not a lot of money to be made in that side of the world, and that's the reason I got out of the Navy. I loved it. I was good at it. I was promoted very quickly, and if I could have made more money, I would have done it. But it changed my life and made us who we are. And someday you should be invited over to speak to a bunch of sailors or Marines or Army or soldiers or. I mean, they should hear your story because there's a lot of guys that get out of the Navy and they're like, "What am I going to do?" And that's all they know. They got out of high school just like you did. They went to the Navy. They spent 20 years in the Navy. Like, what am I going to do? But there's a lot of great success stories of guys like you and I that have served and learned. A lot of the stuff that I still, all my clothes are still lined up in my closet, color coded. I wear the same colors all the time, just because it was so easy back then, right? I wore camouflage, Monday through Sunday, and I try not to have anything that's camouflage now, but I always wear the same colors and things. So I learned a lot from that.
Okay. I got a question. I got a question though. So if you could, would you go back into service right now?
Tomorrow.
Me too.
If they called me and said, "Tom, we need you," I'd go tomorrow.
Yeah, me too.
By the way, and I'm in shape and ready to go. So
I feel like
call
I'm
me.
in decent shape. There's an Iron Man under here. Remember that.
Yeah.
And
That's right.
I feel like I'm but I would go in a heartbeat. I don't know if I would go back to being the guy on the flight deck as a final checker. Or being the electronics guy. They're probably much more advanced. But if I could be a coach and some sort of do something, I'd go in a second, man. I'd be so honored. It'd be
Yeah, I
fun.
played on the Marine Corps football team, and I loved it. And I had the greatest camaraderie. There was a guy, Chief Thomas, who's a Navy chief who, was my inspiration for many, many years. I worked for him for 8 of my 10 years I was there, and the guy's, I mean, he's an angel. He's him and I still stay connected every now and then, and he's absolutely was the inspiration for me. And I mean, he might have been the biggest, strongest guy I've ever met in my life. I mean, the dude had muscles. His muscles had muscles. I mean, he was unbelievable. But him and I played linebackers together on the football team, and man, we had a great time. And yeah, I mean, the camaraderie of that was just unbelievable. So I would go back tomorrow if the president needs me and he calls. I'm gonna pack my stuff and go. My wife's not gonna be very happy, but I'm gonna go for sure.
I'd go. Let's go. Let's go together. I'm ready. If you get a call, Aaron, pick it up and call me.
Yeah, for sure. How did their Navy service? How do you think that influences your decision making in your as the CEO of Trella? Did you learn something there that helped you make decisions or guide the team or build a culture around your company?
Yeah, well, I think it's a good question. When I was in the service, I think I was very curious. Like I wanted to know everything, and because of that, I quickly learned a lot, and I got recognized for that. And I worked hard. I was one of those who had to work hard. I had to work hard instead of being smart. I'm literally I just outworked everyone, and so I got recognized, and I was asked to be a very young leader. And I quickly failed and made some mistakes, right? Like trying to boss people around or tell them what to do. But they helped me quickly learn that there's some things that you need to be able to communicate. You need to build trust, which was huge. And then I think probably the big one was I quickly learned the need to understand the why, right? Like people, you'd say, hey, you need to do this today, and here's what we're going to do today, and they would do it and say, well, why are you back here sitting at a desk, telling me what to do and how to do it? And you kind of had to just connect the why, and then that helped build trust. And I would argue, today that's hugely part of, the why and what we do.
Sure.
Building trust as a leader, right? I mean, I know you have to do it. Um, that's probably what I started. First thing I got, and I've been able to have successes and failures over the last, 20, how long is that now? 20, 30 years? Oh my gosh, I didn't want to say it.
You're old.
I don't want to say it. How long is that? But yeah, and with time comes a lot of other ones.
HCHB is proud to sponsor the Last Visit First podcast, which explores the complex issues faced by today's home health and hospice providers.
In the spotlight today, Chief Revenue Officer Hannah Pearson, explaining how HCHB uses technology to connect people.
One of my favorite phrases is relationship architect. The focus is about the client and building the right community, the right fabric of community around our customers, making sure that from the very bottom to the very top, they had a resource and a contact to reach out to with any problems, and that we could connect them quickly and expeditiously to the right resource. That's where the client success team was born, and we touch people at every level of the organization.
I'll tell you two stories funny things that happened to me when I was in the Navy. So I took my first leadership role in boot camp. I was a paramedic before I got into the Navy, so I was way more advanced than most corpsmen. But during boot camp, we, I was the RPOC. The RPOC stood for Recruit Petty Officer in Charge, and so we were working in the galley. It was our galley week. Everybody has to do a week in the galley, and so some people were cooks, some people were in the dessert area, some people were in this. Well, anyway, they had these stupid hats we had to wear. They were like these paper McDonald's looking hats. And the company commander came in there one day and he said, okay, you guys, on your hat, you need to write your ID. So write the word ID. So I wrote ID. And then he said, you're in group 10. So put 10 on there. And then you're in training. So put a T on there. So we all did that, and you're all scared in boot camp. Not scared, but you're intimidated by these guys. And so we walked around for the whole day with idiot on the side of our hat. I was like, I didn't figure it out for like 3 or 4 hours, but we're walking around with idiot on the side of your hat. Everybody's making fun of you and laughing at you, calling you an idiot. You're like, what are you doing? So that was one. And the second was I was at the emergency room in Orlando Naval Hospital, and I was I was probably E3 by then, and the doctor comes in. It was Dr. Pope. He's a great guy. I love Dr. Pope. And he comes in and he says, all right, I need someone to run upstairs really fast. You got to go up to the maternity ward, and I need some fallopian tubes right now. Run up there and get them. And so I go running upstairs. I'm like, hey, it's kind of an emergency down in the ER. We need 2 fallopian tubes. And the nurse is like, well, you can't have mine. They all knew it was so I went looking for fallopian tubes. She's like, you can't have mine. I go back down to Dr. Pope. I'm like, hey, I couldn't find any fallopian tubes. They didn't have it. He goes, I know they have them up there.
Where were you in basic?
I was in basic Great Lakes.
Right. Okay. I was in San Diego.
Yeah. You were Hollywood. We were cold. I showed up March 22nd in 1990, and it was the biggest snowstorm Chicago had ever had at that time. And you walk around in those sweatpants that they give you that have Navy on them for the first 2 days before you get all your gear. And we froze to death. We had to run to chow and all that. We couldn't walk, couldn't march because it was so cold outside. You couldn't be outside for more than 5 minutes.
We were in San Diego, beautiful weather, and I was a squad leader.
Yeah.
Sort of similar, I was just picked. I don't know why they picked me, but I was a squad leader. And another squad leader, Herzog, I remember him so closely. When there's a week that you can go and you can try to qualify to go to BUD/S, to go to the SEALs. You want to be a SEAL. And Herzog and I, as squad leaders, we'd sit outside and we were doing push-ups one day, and we were just kind of doing pull-ups on the bar while everyone's washing the white hats and doing some push-ups. And our company commander saw us, and he comes out and just started freaking out on us, man. He brought a chair out and sat it down and made both of us sit there. And he said, you're doing push-ups all night until one of you starts to bleed. And so we just sat, it must have been an hour, 2 hours into it. And finally, Herzog, he had just had his wisdom teeth out. And all of a sudden, he's like, he I don't know what happened, but he managed to get some blood going, and he's spitting it on sir, I'm bleeding.
That's awesome.
It was fun, man. We had a great time. What a number.
Yeah. Well, let's jump into Trella. Trella is known for reshaping how providers think about referrals and growth. What's the biggest shift you've seen in post-acute market over the last few years?
Well, yeah. So, by the way, it's been 5.5 years since I joined Trella, which
it's amazing.
Yeah, it's crazy. I think we were like 100 customers. Now we're over 1,000. It's just been such a fun experience. But so what's changed? Let's talk about it. Consolidation. I don't know if it's changed. It's still happening. Private equity, of course. I think I was listening to the podcast with April, and and it's it's interesting to hear how you had all these people who started these agencies, and now, people are buying them, they're consolidated, and private equity's involved. So that's interesting to me. You have some natural tailwinds are still happening though, more people getting older and living longer, which I think is a wonderful thing. I don't necessarily know that's changing, but it's happened. And then, value-based care. Since I've been here, you keep seeing evolution of value-based care. It's real. One of the
Sure.
reasons it's always been one of our three major pillars of our strategy, um, and that's not stopping. And we should talk about team in a minute. Some other things that are going to keep happening that I think super super interesting. And then, think about consolidation. Like one of the largest payers in the country now owns the largest PAC provider, right? Think about that for a minute. So what's happening? Are you going to see more acquired networks? Are you going to see more partnerships? I think so. Are you going to see more things like that where people are trying to own the entire care setting, and the flow of patients and control that more effectively to manage quality and cost? And so those are things that I think are right in front of us and are going to keep going. So we're definitely keeping that in mind. It's definitely part of our strategy. What do you think? You think?
Yeah, I think the other thing that's in there that's really interesting and I've seen this evolve a lot in my 20 plus year career here, but it's the introduction of these electronic portals at the hospital, these discharge planning portals, and so it's changed the way that salespeople react. It's changed the way that hospitals discharge patients. They're whether they're on CureSpan or CarePort or Aiden or one of these portals out there, and I think that's made it interesting, and that's been a big shift for what Trella has to do too. On the CRM side, we're no longer going to the hospital and talking to the discharge planner. You have to be enrolled in the portals, you have to be watching the portals. Intake's totally changed. So I think it's changed the game a little bit. It's actually made it harder, but easier in some aspects. The harder side of it is, everybody's creating robots now to put on these portals to accept referrals as fast as they can. That's changed the game a little bit. There's a lot of noise coming into the EMRs. Conversion rates in home health are way less than they used to be. Back when everybody was Medicare, it was easy, right? You took every patient you could get. And now it's, do I have a contract with that payer? Is the contract good? Do I have capacity? Do I have nursing capacity? So I think COVID brought us that, they kicked all the discharge planners out of the hospitals and put them in their homes and bought all these technologies for them. And so it changed the game a little bit there, but I think it's still positive. We still have salespeople going out and, making relationships and doing all those kind of things and making yourself aware, but it's changed the game a lot. It's no longer go to a doctor's office and get handed a referral. It's getting sent into the portal. You got to, do some, QA on it real quick to see if you want to take it or not. And then, you click buttons and it's automation. Technology is going to help that a ton, but, we still have to go to the right people. We still have to get our name in front of the right people in order to get the business. But yeah, I think that the value-based care stuff, it absolutely has changed a ton. All these different models they keep coming up with. And I think it's making it harder. Paperwork's getting harder in home health. I've seen it really change over my career. I remember back in the MO825 when it was a number of therapy visits you were going to do, and that's how you really got paid, based on the OASIS questions and that. And they changed it to, PDGM and M2200, and they changed it again. And so I think the government's continuing to try to, tweak the model to make it, and they call it behavioral adjustment, which I think is kind of a dumb name, but they want to change the behavior of these agencies. But really all we're trying to do is care for the right patients. And so I think value-based care is a good thing as long as, we set the standards and everybody follows those standards. What innovations or product directions excite you most about Trella's roadmap? So I know you guys have done a bunch of acquisitions, or not a bunch, but a few. Let's talk about them. I want to hear about them.
Yeah. Well, we've done a few, but primarily though, if you think about 80% of our growth is organic. We're a product company. We heads down want to innovate and build new products and think about our business, and it very well, and a lot of people around us know it. We've been able to identify big problems and then create really interesting solutions off those big problems. So, and that's the innovation cycle, right? That's in front of us. And so the first problem was, how do you take all this massive billions claims data? How do you simplify it into some insights that you can present to post-acute so that they can learn and be educated and understand their markets and understand their growth? And as I always say, most importantly, understand their quality and how they can start to compete on quality. And that turned into a unique thing where a lot of our users became a lot of these sales organizations and sales reps who were out targeting physicians to refer business, and they would talk about their quality, and the physician would refer. So our customers started talking about how do we more effectively manage that referral. So we had on our roadmap to build like a physician referral management system. And then we found an interesting, small technology platform that enabled us to buy a CRM, and that became that platform. And that was I guess that was in 2021. So the problem then, which is really interesting, is a little different. The first problem was data and insights and how to make it act, how to be able to take that and simplify it for someone. And that was a big problem. And we've done we've done a good job of that. And then it's how do you then take action? How do you build a workflow that then takes that data and turns it into some sort of workflow and action where you're actually solving the problem and not just giving you the insights to solve it? So that's where I coined this entire term 4 or 5 years ago, this intelligent workflows, right? Embedding our insights into a workflow for CRM. And that was interesting. And, while we've made a lot of progress, I guess, since 21, 22 there, that also, that kind of has been leading to the next problem. It's something you were actually just talking about. As we have been growing in the market and an amazing customer base, a couple years ago, we started thinking about, what's the next big problem for our customers? And one of those problems is how you're connecting, because our patients and our customers and our patients are now getting half of their referrals come from the hospital upstream system. So we realize and watch this problem of, time to start care is difficult. Adherence is difficult. When a hospital discharges a patient, oftentimes it's what they consider going to the black hole. That's difficult. And then if you think about value-based care, and a huge pillar for us, we started thinking about how can we help our post-acute customers get ahead of the referral in the hospital and in the health system. And if we could get it, we integrate with 30 of the post-acute EHRs, but if we could then start to integrate with the acute systems and see the patients earlier on, we could help better match the acute patient in the hospital with post-acute. And if we can do that, and we'll dive into the details of what we want to be able to do there, we can then think about improving start of care, improving adherence, making sure that we get down to quality, that where the patient's going, the choice that they have is matched with DRG capabilities within the post-acute providers. So quality starts to become the most important thing when you think about the hospital and post-acute relationship. And then, why does that matter? Anyway, so we saw that problem, and it became one we wanted to solve. So most recently, we went and bought a solution. It's a small company that automates the discharge. They are embedded into the hospital acute setting, and when the patient goes to be discharged, they help to kind of analyze the post-acute environment where they can go. They provide to the patient choice, and then they electronically and digitize all the discharge information downstream to the post-acute provider. So that's a problem we're solving now, and it's exciting because so going back to our strategy, there's really 3 pillars, right? Post-acute, insights and workflows. Now hospitals and health systems. How do we better connect post-acute to those hospitals and health systems, and value-based care? And if you put those 3 components in a triangle and you put the patient in the middle, you can start to think about what's next, right? You can start to think about the innovation. You can start to think about what else can we do. We're now able to start and connect acute to post-acute more effectively. We're able to get people to the right place at the right time more effectively, and give them the information they need with insights as well. And then for people who are under contract and capitated plans, and people who are participating in teams from the hospital and the post-acute level, we have all this insights to help them be successful. So, that's been a third big problem we've been solving, and there's a lot of other problems. There's a lot, as you know, and a lot of big problems. The hard thing for us like when you have all the data that we have and now all the workflows that we have, um, you sit back and you say, you have to be really good at saying no to some good ideas so that you can say yes to some really great ideas.
It's true.
Um, yeah, and that's where we spend a lot of time.
Yeah. And it's where entrepreneurs usually fail, right? They usually start chasing everything. And if you can say no to a few things and yes to the right thing, it's a gamble though, right? It's like you're going to bet on black or red,
Yeah.
high numbers or low numbers. And it's a gamble. But if you get it right, it's fun. It's a lot of fun. And you got it right a lot. So congratulations.
This is Scott Beard, Chief Strategy Officer at Maxwell Tech. One of the biggest challenges in post-acute care is leakage, when patients leave your care and never come back, even when they need you the most. Many agencies hire staff to call patients after discharge, but the sheer volume means only a small percentage can actually be reached. That leaves gaps, drives up cost, and puts patients at risk. That's why we created NanaConnect Reach, a fully automated text-based engagement platform that follows up with every patient every time. Reach reduces the cost of staffing while delivering something no call center team can match: the automated reach of 100% of your patient population. Patients love the ease of texting, and agencies love the results. Engagement rates are consistently 30 to 40%, meaning patients are not only getting the messages, they're responding. With NanaConnect Reach, agencies lower cost, protect against leakage, and ensure no patient slips through the cracks. Learn more at maxwelltech.com or connect with us via email at sales@maxwelltech.com.
So when you think about that, what are the next big problems, right? I mean, you kind of sit back and you say, Sullivan for some post-acute insights and trying to improve quality of post-acute care. That's important to us.
For sure.
Acute and post-acute is important. Improving how people think about, that relationship of how the patient's going and where they're going and how, and the quality of service care they're getting, and then how that impacts value-based care.
Sure.
So we're not, you know what? So you put those together, you can think about adjacencies. Um, we very quickly went hospice and home health and skilled nursing and DME and infusion, now wound care and dialysis. We've got different workflows we're investing in and developing. But you'll very quickly start to see how's the decision made and automated, and that connection managed. How can AI make the recommendation of the absolute best providers to connect and post-acute providers to leverage to improve outcomes? Um, when you have a capitated contract and you have a hospital with a 3-day DRG and a patient staying for 6, how can you show them how to make that improvement?
Sure.
I can keep going. I got to be careful. I can't tell you everything because my
Yeah.
competitors love to copy everything we do. So
Yeah, it's okay. And they're going to listen to this podcast, I guarantee you. So it's good for me, right?
yeah,
It'll be fun. Let's talk about talent a little bit because you've hired some amazing people. I think Kathy Ford, Jess Chu, Tyler Arden. These guys, I know them real well. Where do you find all this great talent? Holy cow! You've done an amazing job of putting the right team on the field. Even David, who I know you stole from me for Kira, but
thank you.
Yeah.
Thanks. Sorry.
I found that out. I found that out the hard way. Like while we were closing the deal. Like, come on, man.
Yeah. Well,
Where do you get it all? Other than stealing from me, where do you get all that good talent at?
look, man. There's 3 things you got to do right. You got to have a good strategy. You got to have a good team, and you got to have elite execution.
That's right.
And team's hugely important. I think we are very lucky. The team we had to get us so far got us there. And then we were able to start to then, and a lot of those people keep getting promoted and they keep evolving, the Tylers and the Jesses who started as, number 1 sales, number 1 marketing, and now are general managers and running divisions, which is fascinating to watch them succeed. And then as we kept expanding TAM and we have a better story and strategy, and reputation has been a huge part of it, and brand. We've been able to recruit people like Kathy who's come in and make a huge difference. And David Kerr, we just brought on a CFO that, is going to be helping to take us to the next level. And we're very fortunate, but, you know, team, you need great culture, I guess. We've somehow, some way managed to develop and build a award-winning culture. And I credit everyone in the company for that. Um, and people see that. Our customers see it.
Sure.
We share it with them. We live it every day. And if you don't believe in our vision, our mission to help healthcare, and you don't believe in our values, and you don't have the values, you probably aren't there because you don't fit. So therefore, we start to get to a group of people that want to strive for better healthcare. They want to, they're curious. They want a continuous improvement. They want to support each other. They do what they say to customers. These things that are so important to us. And I think that those values and have built the culture, which builds the team and helps you with
Yeah,
team.
I think it's and another one of your skills that I've noticed over the years, and we've known each other for a long time, but your ability to assess talent quickly and say that's the right person on our team, and that person's humble and they're hungry and they're smart and they hustle, right? I mean, those are the Maxwell core values, right? You got to be hungry, humble, and you got to have hustle, and you got to be smart, and you got to be willing to learn and change. I mean, this industry's changed so much. I've learned, this month alone, 10 different things came out that we were like, okay, we got to go study that. We got to learn about that. And so if you think we're doing it the old school way, you're not doing it. And so, yeah, good for you for being able to assess this talent. And I mean, you have some really superstars in your team. People call me all the time about like, who's a star sales rep out there that we should go recruit. And I'm like, well, and I know one, but you better not go get him because I'm gonna have to have a long conversation with Tapp if you do. So,
we have tenure, and it's great. Our people ops team, Leanne, we're fortunate. I tell you, I will say this, maybe one of my secrets. Please don't tell anyone else. I'm a huge believer that vulnerability is a strength. And that's a big deal for me. And I don't care who you are. If you can allow yourself to be vulnerable and recognize that it's a strength, you can go a long ways. It's not one of our values, but it's embedded in everything we do. So the team of people that I try to surround myself with, they know that I'm proud to be very vulnerable. By the way, when you're in healthcare, you kind of need to be, because I have someone come in the office every other day and they're talking about something. I'm like, whoa, I do not know what that means. You know what I mean?
Yeah. Yeah. Hey, I chase fallopian tubes up the stairs.
So
That's awesome.
yeah, it's like, so I really believe that strongly, and it probably has gone a long way for me and people that I get to work with.
Yeah, that's awesome. So in home health and hospice, referrals and admissions are everything, right? Growth is everything. Everybody's trying. I mean, quality is the number one thing we all worry about, but how do we grow these businesses? How do we make sure we service the patients?
Mm-hmm.
When you look at your data that you guys have, and I mean, you have tons of data, and please explain to us how you get that data and where it's at. But what are agencies consistently missing, or what are, what's the number one thing that people should be focusing on?
Yeah. Well, you actually said it, quality. And I don't want to discount that, but so, a lot of people use this for different reasons in different ways. You have different, a big thing that we started with was just market visibility, help them identify, where referrals are going and who to target for referrals. So that's been a natural kind of reputation that we built, that we help companies grow. And if you're fast growing, if you want to grow and you're smart and you've got great strategy, you're probably one of our customers. That's just the best of the best, kind of come to us and leverage our platform and capabilities for that kind of stuff. But what I would tell you that is probably the most important thing that you can do in our data set, and our data set is evolving. Let's talk about it in a minute. Let me just tell you this. If you think about value-based care, which is what we talk about all the time with our customers, and you think about the data that we have, which is the currency that you've got to have. You have to have data is the currency. You have to have it. And if you spend the time understanding quality measures, and you spend the time double clicking into those quality measures by DRG all the way down, and you start thinking about, how do I perform based on a DRG? How do I perform with this episode? How do I perform with Team's a great example of a lot of stuff that we just put into our product. Team, you want to be able to think about those 5 episodes and the DRGs underneath those episodes, and then how I can perform as a provider based on my quality in those DRGs. And I really do hope that, and we talk about it internally a lot, probably not enough. We do all these webinars and we try to educate. But if you can look at the insights and understand quality measures, you can win. You can differentiate yourself. And if you're not doing that, I would tell every CEO, I have dinners with them all the time and talk to them all the time and help them with their strategy all the time. Have your clinician and have your teams thinking about quality. And those are the things. What about you? Now, you use our product every day.
Yeah, we use it a ton.
Yeah,
so
you tell me.
And so I always tell a story. One of the things that I love about Trella, and one of the guys that invested with me, William Deary from Great Lakes Carrying back in the day.
He's a great
Tyler
customer.
Arden. Tyler Arden and I flew up to Detroit to sit down with William. He wouldn't travel with us, so we flew up to Detroit and we met him in the airport at the Delta Club. He was going somewhere, and so we spent 4 hours together. And he beat the heck out of us. I mean, he told us all the pieces of the products that was wrong and all that, but we listened to him and we did a lot of cool stuff. And we added a lot of those quality measures because of William Deary's requirements. He's like, I need this. I want to know average visits in the nursing side. I want to use that. But William taught me, he's like, this is where I learned this. So, and I use it all the time. He said, they were an acquisition machine. I mean, Great Lakes was buying everybody back then. Great Lakes is now in Clara. And William said, it was me and Ian Giuliani, who was the founder of Trella. Back then it was called Excel Health. So anyway, we sat down and he's like, Tom, there's a M&A strategy here. And I'm like, what do you mean? Tell me more. He's like, we can go put dots on a map. We can go figure out who's where, who my competitors are, who's good, who's bad, who's servicing, how many Medicare lives are in this county, this city, this state. And he said, then let's take it to another level. And he's like, if we're buying hospice, and this is where I use it all the time, and we buy a lot of hospices and roll them up and help companies buy hospices and do M&A strategies and stuff like that. But taking that data and say, okay, who's the medical director? Who's the person that's referring all the physicians, or where are they getting the referrals from? That's the most important piece. If I buy a hospice provider or a home health provider and I don't take care of those doctors the way that I should, then that business goes away. And so what did I really buy? And William really focused on that M&A side of it. And it blew me away a little bit. I'm like, I never thought about using the data for that, but it's a great strategy. And I tell another story. I was sitting with Ian a long time ago, and one of our goals at Trella, one of his goals at Trella or Excel Health, is he wanted the Trella name, just like I did at Home Care Home Base when I was there. I wanted our name in every SIM, in every book out there that someone was either going to sell their company or was buying a company. You wanted to make sure the Trella name was in there. And so as we started getting these SIMs coming in, people were wanting us to buy their companies. We started seeing that. And so I remember I got one day and I just took a screenshot of that page and I like, Ian, it's here. Trella Health is now in the SIM, and they're using the data from Trella, screenshot out of Trella in the SIM to prove their medical directors or who refers to them or where they're getting their business from or their quality scores or their star ratings and comparing them to their competitors and why you should buy us in this community. And I was like, holy cow, that's a home run. That is what you want. You want every private equity company in the United States. You want every venture capitalist. You want every banker. You want every home health and hospice agency to be comparing themselves using your data set. And you guys did it. I mean, I haven't seen a SIM in years that didn't have some reference to Trella in it. It's pretty cool.
Like it's actually super cool. And so a couple of things here. I love it when I see our brand, when people are talking about, here's how we improved outcomes in healthcare. And here's the data. We went from this, start of care. We went from this readmission rate. We went from this. And you can see that naturally, and they're showing their boards, and they're showing, they're presenting at Home Care 100, and there's our name. That's the most rewarding thing for our company, for me, the company, for Ian, who on the board and still doing great. I talk to all the time. That's cool. And the other thing that I just note that you mentioned is our customers find new ways to use our data. They're in it all the time. This is a great example. Bud Langham, our good friend Bud.
Yep.
Bud was on the phone with me a week or so ago. It's like, Scott, look at this in your product. And he starts showing fraud, and he's picking up these home health and hospice agencies and why they are fraudulent and how they're not good people. And I'm like, I never really thought to even spend time in our product doing that, but that's helped, people, a lot of papers that are being written right now. You think about a lot of the briefings and white papers that are being written, leveraging our data. It's interesting. I actually think what's more interesting is, if you think about our data for a minute, Tom. We started with Medicare claims data, billions of them, and making insights, and then we started aggregating commercial claims, and 1.5 billion claims turned into 15 plus billion claims.
Wow.
Of data that we now analyze and process. But now think about this. We now have integrations with over 30 post-acute EHRs. So it doesn't matter what EHR you are. So we are EHR agnostic, right? And if you're a customer of ours and you integrate with, and you launch our workflows, we integrate with your EHR somehow, some way, and we have and see every single one of the referrals coming from those providers. Okay. We now have the same type of integration with the acute setting EHRs, and we're seeing all of those referrals happening. We are seeing, we have billions of claims. We have tens of millions of referrals now coming across into our platform. And now you go, oh, wow, okay. It's a challenge. Now it's about interoperability. It's about what can I do by consolidating all of that data, open claims, closed claims, referral data. So 2 years ago, I was having lunch with Thomas Carlin, the CEO of Google Cloud. And he says to me, he's like, Scott, you're sitting on data. Every AI company in the world is dying to get to that. And so interestingly now, we're going to, we have this big vision of, and I can't tell you all the vision, but I'll tell you this one. We're figuring out how to aggregate all that data together to give to our customers so they can think about other ways to use it. And
That's
when you
awesome.
think about creating amazing outcomes in healthcare, no one else is doing that. And so
Yeah.
our customers just keep having more and more that they're going to have access to, and we hope we can keep helping them along the way. So it's pretty exciting.
It is exciting. It's my brain is now spinning, as you know, of all the ways that we can use that and help it. And I'm a big fan of the data. I've been all along, as you know that. But I remember when Medicare was the primary dominant play, and we were trying to get, you were trying to figure out how to get that Medicare Advantage data, and we kept telling you, hey, Medicare Advantage is coming. And now most providers are 60-40, Medicare versus Medicare Advantage, maybe some 50-50 or upside down. And I remember telling you all the time, like, Scott, you got to figure out how to get this data. And it's hard, right? I mean, Medicare Advantage doesn't want to give that data away. It's not cheap. It's easy. It's expensive to get it. But being able to roll that up and really get a true holistic picture of what's going on in the home health agency versus just the Medicare data is pretty amazing. So congrats on all that. That's really cool. And I can see where you're headed. Like I can, I always say I got LASIK a few years ago, and just so I could see my golf ball go in the water easier now. And I'd have to go wonder if it went in the water. I could actually see it splash, and it's amazing. But I can see where you're headed, and thank goodness I got LASIK. I'm excited for you. That's really cool.
Yeah, well, we'll need your help. So
yeah, I'd love to. It's fun. It's a blast. These are problems that I want to solve, right? I retired when I left home care on base and really for 77 days did nothing but play golf, and it was fun. I loved to golf. I play golf all the time, but this kind of stuff just stimulates me, and it's something I want to help solve. It's really cool. If you could give one piece of advice to a home health or hospice CEO competing in today's consolidated market, what would it be? And I think you already said it. Quality, right? Focus on quality. But what else would you go?
Yeah, I can get very specific. I'll get very specific. I mean, right now it's just starting, but are you following team at all by chance? Yeah, of course. Yeah, of course. I mean, so, CMS, when you think about value-based care, is always coming up with the next thing that they're going to test to see what succeeds. This one's very interesting to me because, you have these 5 episodes that they're going to capitate and a payment, and they're going to pay a certain price point for when the patient enters the hospital for 30 days after. And I would, so I would really think about that model and how that could go to the next episode, the next episode, and the next episode. And as you think about growing your business, how are you thinking about making sure that you're aligned with where these hospitals are going and these capitated, these at-risk plans and payment models? Because that's, if this works and it keeps going and value-based care really, they hit the goals that they want. It may not be 2030, maybe it's 2035, whenever. I fully expect payers and others to keep going down these type of paths, CMS being one of the big payers. So I would, I would dig in our product and I would look at the team data that we put together. And if you need help, I'd go to www.trella, call 1-800-Trella, get someone on our team to point you in the right direction. Because it's very clear, here are the plans that are happening in value-based care. Here are the DRGs that matter, and those are going to keep expanding. And you ought to just line yourself up with that. And that is lining yourself up with quality. I've had, multiple CEOs I've been having dinner with and just lunches and talking about strategy. And I would just focus there for a while. I think it's important.
Yeah.
January 1st is the date for it. And, get ready.
Hey, this is Alex with Steno Health. Our mission at Steno is simple: to improve the quality of life of the post-acute care clinician. Steno uses ethical, compliant AI to capture visits in real time and turn natural conversations into accurate notes and forms. We are clinicians ourselves, and we've designed Steno to never feel like an extra click or an extra burden in your day. The goal isn't to replace anything, but to support you in every aspect of your day so you can spend more time with your patients and still have the energy and freedom to be present with your family at the end of the day.
Let's talk about a little bit more AI stuff. So I know we talked a little bit about, kind of your unique data set and all the things you're going to do, but as you're balancing AI innovation with human judgment, that's pretty tricky. How do we ensure Trella builds trust while delivering cutting edge tools? What do you guys focus on there?
Well, AI is, oh my gosh, we're talking AI all the time. We've got, I think AI is going to be a big part of our long-term strategy. I can tell you a couple of different things about the way we're thinking about it. We've got billions and billions of data to process, and leveraging AI and bots and agents and things like that can truly speed up everything we're doing. We have to have it in the right format. That's probably the hardest part, interoperability and getting it in the right format. And that's where the money's been spent from the 10 top AI companies who have spent $2 billion plus, right? You gotta get it into the right format. But once you do, there's a lot of things you can do with it. And I think it's just going to help improve the speed of which decisions are made. I definitely think when I think about AI and I think about our workflows, I think it's going to significantly improve the speed in which our workflows can act. When I think about, comparing, a great example would be think about discharge from the hospital to post-acute. A quick, AI leveraging the fact that they can you can see best provider to send to based on different quality measures, based on characteristics of the patient in real time to make a recommendation. Ultimately, it needs to be a decision for someone who's been educated in making that decision. But if we can speed up the recommendation, we've already seen where, we're reducing, and this isn't even with, AI, average length of stay, for instance, for hospitals, because we're better connecting post-acute with acute, and we're saving, like Yale as an example. They said we saved them $16 million last year just because of that connectivity, which is amazing. And I think as we think about doing those things, we're going to be embedded in AI into all those workflows, and it'll be data driven embedded. So it's awesome. I don't know if, like we were just talking about, like taking our data and embedding it into the EHRs using AI and bots, which is very naturally something that can be done. I think the key there is, how do you make sure when the bot cannot finish what it's trying to do, and it alerts a human that it needs interaction.
Yeah, it needs intervention.
some sort of intervention or something that needs to interact to with what's going on in the workflow. Um, and those are things we're thinking about right now. Um, and core to a lot of our strategy, of course.
Yeah, I think of some, really basic, simple solutions that AI does for us in our lives today. I use it for everything. Everybody knows I'm an AI junkie, and I spend a lot of my time, building AI. But if you think about just a simple solution, I go to Starbucks every day. Shocker. Every day I drink one of these. Scott Beard turned me on to this. This is a
What is it?
iced Americano with 4 pumps of sugar-free vanilla in it. I drink them every day.
Um,
I'm addicted to them big time. It's stupid. I spend way too much money on it. I shouldn't. I should make it myself. But Starbucks is right down the street from me here. But back to AI, when I get in my car and leave the gym, it knows that I will just left the gym, and it knows I'm going to Starbucks. I always go to Starbucks every day. And so the Starbucks app on my iPhone opens up. Like, how does it know that it's, 7:00 in the morning? And when I pull up to Starbucks, it's ready to go. And I don't even have to tell it what I want anymore. It just says, I can tell Siri, hey, Siri, order my Starbucks. And it knows what Starbucks I'm at, where I'm going, and orders it. And it's ready when I get there. But somehow AI has figured out that I leave the gym, do it every morning, go to the gym, and go to Starbucks Monday through Sunday. And it's a simple solution. Instead of me having to go on my phone, find the Starbucks app, go figure out what I want to drink, choose my order, all those things, it knows all that, right? And so it's made my life easier. And so that's a stupid, simple solution, but it's made my life easier. And so if we can take that same mentality and do that in home health or hospice or doctors, if I'm a sales rep and I'm going to, Dr. Smith's office, and I pull up to Dr. Smith's office, and it can grab all that intelligence, and it could say, hey, Tom, when you're in there talking to Dr. Smith, tell him about these quality measures that you're better than. And by the way, he refers all of his patients to ABC Home Health, and you're better than ABC Home Health and all these quality measures. Why can't you just spit that out to me right there? I walk in, show him a screenshot. Doc, here's why we're better. In hospice, we're doing more visits in the last 7 days than this guy over the street. Why would you refer your patient over there? All those kind of things are easily done with AI and data. And again, we're not trying to take away the sales rep's brain. We're trying to make it easier for the sales rep to do their job. And if I can get you, rep, to go call on 20 doctors a day versus 10 doctors a day because you don't have to do all the research and all that stuff, am I making you more effective? Possibly. Am I going to make you more money? Possibly. Am I going to get you more referrals? Possibly. Am I going to make that story easier for you to tell? Possibly. And so I think all those things, and people always ask me, like, are you scared of AI? I am not scared of AI. I don't think we're going to have robots taking over the world. I think we're going to make business decisions easier because we'll have the data in real time. We don't have to go look for it or study for it. And so I think that's the home run.
I do believe, especially in healthcare, this revolution of AI right now, it's probably the number one thing that can help this industry.
Let's move on to the next question. Where do you see Trella going in the next 5 years? More acquisitions, more partnerships, more EMR integrations, more service lines. Where are you going?
Yeah. So, let's go back to what we were talking about earlier, right? So, think about the 3 major strategic pillars for us, right? Post-acute, hospitals, health systems, and value-based care. And put the patient in the center of that. How we more effectively, add workflows to all the data that's coming out of that, I think is going to be massive. Think about things like care coordination. One of the biggest gaps that we have today. How are we actively connecting all of these constituents and the patient so that we can improve coordination of care? That's a very natural extension for us. There's probably a ton of other pockets that we could get into, and we'll consider. We'll heads down think about product first and innovation. Right now, still just about every dollar that comes into our business goes right back into product innovation, and we are very fortunate to be able to do that, and we want to keep doing that as long as we can for our customers. So we'll be designing and developing and the next set of innovation for that ecosystem that's there. So I think that's interesting. Speaking of ecosystem, and a couple of things I don't want to tell you, Tom, because I don't want people to listen to it. But if you think about ecosystem now, we have this ecosystem that's being developed of our post-acute customers every time we turn on a new hospital and health system, like for instance, we launched Baylor Scott White 2 weeks ago, and we added 1,040 post-acute providers to that ecosystem.
Wow.
So we're starting to see, billions of claims, millions and tens of millions of referrals, and we're building out this ecosystem of access to information. And what I'd love us to start doing more, and you'll see this coming in some of our next product releases that we're working on, where our insights and our workflows are embedded with education and content. How to do this, why to do this, the way to do this, very much educational. And then, with that ecosystem, think about the things that you can do. We've had a lot of customers ask us to put on user conferences, and we've said no right now. We've had education webinars and content that we can design and develop that we want to keep doing to keep empowering them for things like value-based care. And this was something, we're very much customer-driven innovation. We love listening to our customers. They've created a lot of our ideas for us, and we just take it to the next level. We've had a number of our customers asking us if we can do something for the patient. And what would that look like? Because again, post-acute, hospital and systems, value-based care, all the connectivity with the patient in the middle, what are we going to do to help coordinate care and create solutions for the patient? And that's on our list we have ideas. We got to figure out what to say no to so we can figure out what to say yes to, but we have some ideas. So it's exciting.
That's cool. That's exciting. I talked about on one of my other podcasts that I was talking to a few doctors, and it's amazing that consumer is now so much more educated because of AI. They know their disease. They know the signs and symptoms. They know, if you have Hashimoto's disease or you have, whatever other disease you have, you can now go use AI and study it and figure out all the signs and symptoms, medications, and treatment plans, and all those things. And so it's positive and negative. But you're right. I mean, the patient's in the middle of their own healthcare, and I think we're now in getting into a society. I'm a big Gary Brecka fan, and 10X Superhuman and all that kind of stuff. Jen and I do all that stuff, and you have to own your own healthcare. And I think what we're seeing is this next generation is really starting to own their own healthcare. Versus you just went to, the doctor that was at the street corner who had a bag and he told you what to do. Here, take this. You need to take this. A lot of people don't even know what it was given them to take. But now people are educated in their own healthcare. They understand their diet. They understand their food. They understand that. This will get me to a question. So I think AI is going to help there. One of the things that's always blown my mind is a doctor orders home health, or a doctor or hospice sometimes, but mostly it's home health. And so the discharge plan instructions out of the hospital says, doctor, go to home health. And you track this. You know this because you know the discharge plan on every claim. Why do so many people not go into home health? Is it we're doing a terrible job on the home health side convincing a patient to go on service? Is it they don't understand home health? Or, I mean, it's an area I know you've spent a lot of time focused on is, the total number of referrals that were referred to home health, but actually the number of patients that got admitted. And I think you're the only person that has all that data. Why do we think that is? What's going on there? Is it?
It's an interesting problem. I think it's adherence. We look at the data all the time. Here, I'm going to give you an example of the problem. So I can actually find a text. I'll have to send this to you. You will be blown away. My mother calls me and she says, "Son, Aunt Marge is at the hospital and they're discharging her. And they just gave me a list of 20 home health providers, or 17 home health providers. It's literally a piece of paper this long. It's a piece of paper, and it has provider, phone number, provider. And they said, Marge, here's your home health. You need to take home health for the next 7 days. And here are your instructions for that. Find a provider. And Marge goes home. I mean, it's chaos, man. That's the problem. That's the black hole. But we set it up way up at the hospital setting, at the discharge setting. That's why we're trying to. That was the issue for us of getting ahead of the referral and how do we improve the discharge and automate the discharge experience, connecting acute and post-acute more effectively. I think if you can do that, you can improve that adherence. And the other side of that, and actually this is something that I know CMS and they're trying to drive a lot in the value-based care equation, they're trying to put the primary care physician in, right there as the responsible party. I do think there's a disconnect of making sure that the primary care physician is connected in the flow of the patient's care setting, and we probably don't do that enough. And if you could figure out how to automate things when the referral happens, if it's out of SNF or if it's out of a hospital or anything else, adherence would improve. And then if you could figure out how to connect probably the primary care physician and some of the other care settings more effectively to coordinate care, that would happen. And I think you'd see a lot of improvement there. What do you think?
Yeah, it's so interesting to me because I get phone calls all the time. People know families, friends, and those kind of things. Like, Nana's getting discharged for home health. Where should she go? And I'm like, okay, so I have to go into Trella to say, okay, Nana lives at 1933 Seminole in Amarillo, Texas. Who are all the providers available? What's their star ratings? And I always go and do that analysis for them. But I mean, I have major tools, right? I have the best skill set and tools, and I know all these people. If you're a common consumer out there that doesn't have all that, and you're in a different business or not in the home health or hospice business, how do you figure out which one to go to? And then we're asking a consumer, by the way, your aunt, I don't know what she was in the hospital for, and don't tell me, but if let's say she was having hip replacement surgery, she's got to go find a therapist. She's got to go find medications. Where's her pharmacy? There's like 20 questions she has to answer on top of who's my home health provider. And by the way, you're not in the shape. You're getting discharged from the hospital. The first thing you want to do is get home as quick as you can. But how are you going to make all these decisions about your care? Do you need a DME? Do you need a walker? Do you need a cane? Do you need a wheelchair? Do you need, food, oxygen, all those things that need to happen? And now we got to make all these decisions. And yeah, it's a bizarre model. And by the way, the hospital wants you out of the hospital as quick as they can because they only get paid a certain amount of money for that hospital visit. The doctor wants you out of that bed because he's got somebody else in the ER that needs that bed. And you start following this process. You're like, holy cow, there's a reason why we're asking, and it's usually some 70, 80, 90-year-old lady or man, and we're asking them to make a decision, or we're asking their family members to make a decision around what do you want to do with mom and what do you want to do with grandma? And you're like, oh, holy cow. I mean, it's a tough game. And by the way, we're experts in this business, and it's still hard for us. I can't imagine if you didn't have, connection to Scott Tapp or Tom Maxwell or, Jennifer Maxwell to help you do that.
It's a broken, there's so many examples, and we all experience it. It's crazy now because of our parents, right? Like, we're at a point where you're seeing this with your friends' parents and your parents and other parents. Like, I don't know if you remember this, but in 21, when my dad had his heart surgery, insisted on it in the VA. Luckily, it was, which great for him, right? But and then he was discharged, and he had 3 readmissions because the first one was because his home health care didn't start fast enough. And so his, drugs were off, lungs filled up. And by the way, in all 3 of them, he went to a different hospital. He didn't go back. He went to 3 different hospitals where the EMT took him. I mean, it was, and then, it was, I'm like, are you kidding me? And it's so, but it is a broken process. And I do think the opportunity more than ever, as we're talking about, like, AI has an opportunity in technology to probably improve healthcare more than anywhere, any industry possible.
I agree with you.
And because there's so many processes, there's so much infrastructure, there's so many things that you can help outside of just decision, like care decision, that have to happen, and compliance. It's so complex. It's the perfect world for AI. Anyway, we're trying to solve it. It takes a long time. I just wish we could go faster, but I know we're all trying to solve it.
Yeah, it blows my mind that, Anna got out of the hospital and it takes 4 days to get somebody to her house. And what does she do in those 4 days, right? I mean, that is a problem. And it's not because the home health provider's not trying. They're trying to get there as quick as they can. They only have so much staff. They got to go through auth, re-auth, eligibility, get the patient home, get the DME in there, get oxygen in there. I mean, if you get discharged from the hospital and you have ESRD, or you have, lungs problems, or like your dad, a heart attack and had an open heart surgery, there's lots of things you need in your home in order to go home. Food, low sodium diet, water, someone to take care of you. And if you don't have all that equipment in the home, you're going to an unsafe environment. And then guess what? You're going back to the hospital. The next phone call you're going to make after you call your son is probably 911 again. You're going back to the hospital because there's nobody there to take care of you. So I think this is an area that I know we're not going to solve it quickly, but it's something I think we have to continue to focus on. And
I think just very clearly, the time to start a care is so critical and important. I mean, the correlation to readmission is right there. The longer it takes, the higher the readmission. So if you could just if we can look at solving, always like in our company, we're measuring what matters, and that helps us focus where our execution strategies set up. And if you can sit back and say, okay, how do I measure some of these most critical things, and then how do I look at solutions that can solve for some of those things? That's what we need to keep doing. That's the exciting part too of, if we can keep identifying the next biggest problem, and then how do we apply technology to it and innovation to it? That's a fun thing to do. So I hope we can figure out how to solve that. It's a big one.
Yeah. It's a magic. All right. So that's the magic wand question. If you have a magic wand and one big problem you would solve in post-acute with Trella, what would you solve today? Is it adherence?
Right now I'd say care coordination. And that, because I think that would drive adherence. I think it would drive time to start a care. I think it would, I think care coordination is pretty interesting.
And I think about that from a perspective of what if, and this is just dream big, right? So Elliot Wood at Metalogics has one of their core values is dream big, right? And if you could dream big, what if we admitted patients to home health or to hospice in the hospital? Like your nurse, instead of going to the home health, going to the home, they actually went to the hospital, did the full assessment, got all the documentation, paperwork, hooked their medical record up to Epic or Cerner or whoever they were on, got to download really quickly. We know everything about the patient. We talk to the doctor. We talk to the nurse. We're the ones that are managing the discharge. We're the ones that are wheeling in and out to the van in the wheelchair at the hospital, getting the paperwork signed, get her in the van and get her home. Now, I know we need to do the home assessment and we need to get all of our meds and all that stuff, but what if we started it there? So there would be zero delay. I mean, can you imagine being in the hospital and you're in the ER and they stick you in ICU or they stick you in the critical care unit and it takes 2 days to get care for you? I mean, it'd be terrible. So they figured it out inside the hospital. Why can't we figure it out from the hospital to your house?
Okay. So here's a problem to solve. And this, you figure it out in the hospital, and then the black hole happens. You go from one of 4 medical record platforms to one of 35, and they don't talk to each other. All right. And they don't talk to each other well, or not at all, or you're starting all over again and you're spending 3 hours filling out the 70-page questionnaire with, 7 sections on each question, and the time and effort. And it's kind of chaotic to me, but it is what it is. It's not going to happen anytime soon, but if we were all on the same EMR, like if it was like a universal one, it would help. You'd get a lot of answers. You get a lot of questions answered. I think the problem you run into though, so think about if you're the hospital and Tom comes in and says, "Hey, I want to do all my home health, start it here." The hospital's go, "Hold on, huh? You mean you're going to keep that patient a little longer here? I need that bed, dude. I need that bed immediately." Their biggest issue, you talk to any hospital. I was having dinner with a friend of mine who's a ER doc, and he said, we're bonused on average length of stay. I'm like, as an ER doc, you're bonused on average. He goes, yeah, all the doctors in the hospital are bonused on average length of stay. So, I mean, you got to align the greed, you got to align interest, and sometimes it's probably just not as aligned with the patient as it needs to be and where we want it to be. So
yeah, it's interesting. When I was in the military, and as a corpsman in the military, we had a universal health record in the military. And if you were in Bremerton, Washington, or Camp Lejeune, or Naval Hospital, Orlando, I could get to your medical record in the military. Whoever you are, I could get to your medical record. I could go log into, I forgot what the application was called. was old school. It was green screen.
I bet it was an acronym. I bet it was an acronym.
Oh yeah, it was a 4-digit acronym for sure. But I can't remember what it was called. But even though the TRICARE model that you could log in and you could get their, I wish I could remember the name. I'll look it up and put it in the show notes. But you could log into the system and I could tell, you just left boot camp and here's what we found out about you in boot camp and you had something wrong with your heel and we could see your whole medical history there easily. And the military is big. I mean, I don't care what branch you're in. We had your medical record. They were all universal medical record. And I always think about that. Like, what if we could figure that out in America? It'd be amazing. Like, if Epic and Cerner and everybody talk to each other and there's a ton of these HIEs and everybody's trying to do it and they're trying to push data and pull data. And it's all about, compliance and having the rights to see it and HIPAA and all that stuff. But it's definitely a pain. I mean, your vet does it, by the way. The vet systems have great medical records for your dog. They use ambient listening to talk to your dog. They use AI, my vet. I mean, it's amazing. And I always look at it when I go to the vet. I'm an EMR guy, so I always look at their EMRs, and they have amazing stuff in their EMRs around your dogs. But
but
the challenge to stuff we don't have access.
Yeah, the challenge is the different care setting.
That's right.
Right. The challenge is, you have different interests, different things were built differently for each different care setting. And so if you're ambulatory, if you're hospital, if you're post-acute, if you're SNF, it's different than home health, it's different than hospice, it's different than, so the complexity, we created the complexity because of the different care settings. And it'd be a long time to fix it, but it's interesting. But to me, that's fundamental to part of the problem. Just the connectivity and the interoperability. Interoperability is like massive. Solving interoperability, that's one of the things I'm so excited about, but at the same time, got to figure out how to afford to do it, right? Like the investment that we're having to put into interoperability, solving for all that data coming together and making it work and talk to each other and create insights out of it. It's an expensive task. It's a big problem to solve though.
The cell phone community did it, right? Your Android can talk to my iPhone can talk to your T-Mobile, blah, 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 all around the world. And banking systems solved it. I mean, what if you had to memorize your account number and your routing number and your credit card number and you had to, if you had to pay for your Starbucks, all that's on my phone and they figured it out. So somehow we're exchanging money. Why can't we exchange healthcare data? And it's all about money. It's a money problem, right? Epic doesn't want to talk to Cerner. Cerner doesn't want to talk to Home Care Home Care Base. It's all about money. So it's a challenge, point click cares in there. All right. I got a few more questions and then I'm going to let you ask me anything you want to ask. Looking back on your career, what's the leadership lesson that you want people to remember most about you? What's your legacy?
Oh man, I don't know. I don't think about legacy that much. I think two things, probably one, as you develop your career, I wanted to be the best venture guy, the best sales guy, the best it became so much more, it became so much less about me and so much more about the people around me. And about, I think if I could, if I leave one day and people were saying something like, wow, Scott was a great coach for me. That would just warm my heart. I think, I don't have any tattoos. If I had, do you have any tattoos, Tom? How many tattoos?
Not a single tattoo. Me and you're the only two Navy guys that don't have a single tattoo. I want one, but my mom always tells me if I get it, she'll cut my arm off.
Yeah. I kind of want, I thought about my first tattoo would probably be father because I think that's super cool. My next tattoo would probably be veteran. I think I'm very proud of it. Maybe my next one would be Iron Man. My dad, my dad would want me. He that's my nickname for my dad. He's pretty funny. And then I think coach would be right there, just if I could be remembered that way. But I would tell you, if I would, outside of that, if I could pass something to anyone, it would be what I said earlier. Remember, vulnerability is a strength. It really is. It's hard. Even the little things, you don't want to go sit in a restaurant by yourself because it's weird, and you do it, and you have to learn, and you have to, take chances and do the hard things and ask the hard questions when you don't know and admitting that you don't know. Vulnerability is a strength, man, and I hope people will embrace that.
It's super interesting. I've never heard you say that, but I agree with you. It's something I struggle with a lot too. I mean, I'm a social person, but I go eat dinner by myself. I've never been to the movie by myself, but a lot of the people that work for me have, and they're on the road and they travel and they're like, yeah, I go to the movies by myself. I'm like, I would never go to the movie by myself. Like, even though when you go with your spouse or whoever, you never talk to them and, before and after, but I would never walk into a movie theater by myself. I don't know. That's a vulnerability I need to overcome, but you're right. It's, in the world we live in today, vulnerability is a big deal. So that's cool. I'm glad you shared that. Couple quick hit questions, just for fun. What's your favorite podcast? Besides Last Visit First, of course.
Yeah, this one is number one. I listen to All In. I like All In. Sometimes they get too politicky on me. It's interesting, but I like it. By the way, I was just invited to Mar-a-Lago, whatever, for a Turning Point event. We can't go, and I thought about it. I thought about going and seeing all those guys. I'm sure they're going to be there. But no, I like it. I like that, they're balanced, a little left, a little right. Maybe not very left right now, most of them. I think they've shifted a bit, but I like technology. I like a blend of politics, healthcare, science. Those are fun things. I listen to, so that's probably one of them. I like Rogan. I know you and I both listen to. And then Andreessen Horowitz, I'm a big fan of what they've built. And they put out some interesting content, and I'm a big tech guy. I enjoy modern tech, and it gives me something to do when I'm walking or running or working out or driving.
Yeah, I quit listening to music. I hardly ever listen to music. And we'll listen to it on the golf course if there's no football on when we're playing golf. But I listen to podcasts when I work out. I listen to podcasts, throughout the day. If I have a break, or if I go on a walk or, sitting out in the backyard, by the pool or whatever, I always listen to podcasts. And I learn a lot from them. I love Rogan. I listen to a lot of Rogan stuff. He gets weird. He does all the alien stuff and all that. I don't care about any of that stuff. That stuff doesn't excite me. So I'll usually skip those. And then he's a big hunter, and that's okay. I'm not a hunter anymore. And once I served in the military, I quit hunting. But he was a jiu-jitsu MMA fighter. I used to fight MMA and jiu-jitsu, and so I like a lot of that stuff. I love the All In podcast. Another one that I like a lot is the Acquired podcast. I don't know if you've ever listened to those, called Acquired. Yeah, there's one on Schwartz from Starbucks. And so these guys go long. They're like 4-hour podcasts on these different companies. They did one on Epic. They did one on Starbucks. They did one on, all the big companies, Google, all those. And they go real deep. Microsoft's a really good one. But the Starbucks one was amazing to me. The number one thing that Starbucks CEO said he hates is the drive-through and the Starbucks app. He's like, because I built Starbucks to be an experience with the barista. Now, it's also the most profitable thing they have. Yeah, but he's like, I wanted you to have that experience with the barista. It was supposed to be a local community. You get to know your coffee maker. You get to, you're spending $5 for a cup of coffee. You get to know that, you have that relationship. And since the app came out, I don't know when the last time you went to Starbucks was, but there's somebody in there. Every second there's that thing's going off, and there's people in there, pick up their coffee that never talk to the barista. And they write a little message on your cup. You never talk to them. But the interesting part of this is that the number one profitable thing that Starbucks did is they put this app on their phones, and they have the Starbucks Gold card. You can't put your credit card in there and they'll just charge you $4 for a card. You have to charge $25, $35 or whatever. And so they're sweeping $30 out of your account and holding it. You're spending $5, but they're keeping your other $25 in their bank account, and they're sweeping it, making interest on it. And that's the most profitable thing they've done. And it's amazing. The idea, the genius behind that, whoever it is, the CFO or whoever figured that out, they're making a fortune on that portion of it because you're reloading your card. And that's the only way you can use the app is to reload that Starbucks card at $30 a pop.
Isn't that interesting? That is super interesting. One of the companies I ran was a software and payments company, and software was what we delivered on the workflow, but we made all our money in payments. Processing payments and floating cash, and everything around it. This is crazy. Well, yeah. I wrote that down. I don't know the podcast. I love them though. I'm the same.
Yeah. The other one I sent you the other day was The Diary of the CEO, and I like it. He's a British guy. He's really easy to listen to, but he's had a couple of really bizarre ones. That one with Weinstein on there, very seldom do I get freaked out by podcasts, but when you listen to that one, it'll freak you out. The guy is so smart. I mean, he's genius smart, and whether he's right on everything or not, I literally had to Google like 20 things that he said out of there. Like, explain this. What is this? Like, what are we talking about? It's a really good one. So yeah, I like the Diary of a CEO. He's another good podcast to listen to. I love it. We all learn from these things, and I never wanted to be a podcast host, but we figured it out, and I think people are going to learn from this. And so, Scott, man, it's been an absolute pleasure having you on the show. You're one of my heroes. You're a friend, and you're done an amazing job. And I know Ian appreciates you. I know Mark Buffington from Buckhead Adventures appreciates you. I know the Cressy guys love you because you're making them a successful business, and I'm really proud of you, man. You've done a great job.
Thank you, Tom. I appreciate that, and thank you. I wouldn't be here if it wasn't for you. We've had a great time. Thanks for all the guidance and help, and thanks for having me. I look forward to episode 2 with Tapp and Tom one day. Tapp and Tom, and on Last Visit First. So congrats on the podcast, and it's going to definitely be followed and one of my number ones now. So
thanks. Tapp and Tom sounds like a radio show, man. Sounds like a morning show.
Episode 2 will be Tapp and Tom, Tom and Tapp, however you want to do it, and we'll have plenty to say and plenty to talk about. And I don't know if anyone will listen to us, but maybe.
Cool. Well, that's cool. Well, thank you again for coming, and say hi to the team for me.
All right, my friend. Will do. Thank you for having me. Take care, bye.